This segment we're going into now is sponsored by the DC Department of Behavioral Health. And I'm really, really excited to have with us Anthony Hall, who is the Director of Outreach and Education at the Department of Behavioral Health. Anthony, welcome to WIN TV.
Thank you so much. I'm really glad to be here.
So, one of the things I have to start off with, I know we have our questions that we need to go through, but we talked about this a little bit earlier. There's a change in the city, right? And the mayor and others have talked about the fact that the city doesn't necessarily want MPD to be the first responders to people who are in a mental health crisis. And it seems as though you all at DBH are prepared to meet that call. So tell us a little bit about your job and why this outreach and education about what you all are doing is so important and what folks need to know about it.
Sure. Again, I really do appreciate the opportunity. So, in the public engagement section of the agency, we really are focused on being able to connect with the residents and explain what the available resources are, promoting access, and working to identify opportunities where the department can hear more about the needs of the unique communities that exist within the district, as well as sharing the activities that are happening within the department to explain more about what it is that we do and how we can be of benefit and of service. So we do that in a number of different ways. A lot of it from this part of the agency comes with providing information about mental health and wellness, explaining the spectrum of services that exist here within the district, and being able to get the word out. We're really fortunate that we have such a robust and a constantly evolving system of care. And so we are committed to being a direct arm explaining what it means to receive behavioral health services in the community, especially in the district, and also what individuals can expect from those services.
You talked about actually meeting in the community and hearing what the needs are. Can you share with us what people are saying their needs are, particularly the ones that DBH can address?
Sure. There's quite the spectrum of needs that fall under the umbrella of behavioral health. So we hear caregivers who are talking about being fatigued or wanting to understand more about what's going on with their loved ones. We hear from parents who want a greater understanding of how to talk to their children about the changes that they're witnessing, or even explaining the concept of trauma. It's very unfortunate that we are seeing so many instances of gun violence in the city, but explaining, people are talking about the need to have a better understanding of how to cope with the emotions that they are experiencing. So a lot of the work that's happening right now is communities asking, where can they receive these things, and what do they look like? What should they look like? In addition to some of the needs around substance use disorder, we have a lot of vulnerable individuals who communities are interested in finding out how can they support their neighbors, what are some of the resources, how can we engage in a collaborative effort to provide more opportunities for individuals to receive services if they're interested and ready for it.
So I know that you all have this is my word, googobs, but you all have a lot of services that you offer, and that's why I'm glad you selected WIN TV as a place to really promote some of the programs that you have that meet those needs. If you could tell us maybe one or two of the most requested services that you provide and how people were actually able to access those services.
Sure. So the first one that I would talk about would be our mental health hotline, and they can be accessed at 1-888-793-4357. That is a 24/7 direct care call center where any individual can call in to find out about resources, to receive a session with a clinician. You get up to 6 free sessions with a clinician. You can also learn about getting linked to one of our core service agencies, parts of our department, the programs that we oversee. That is a critical resource because, as we've seen, there's been a growth in terms of people's willingness to access care,
Let
especially
me,
out of the
Anthony,
pandemic.
I'm going to interrupt you really quickly because because it's critical, we want to make sure that we put this number up so that our viewers can get that. So can you repeat that number, please?
Sure, it's 1-888-793 4357.
Okay.
Alternatively, you can dial 988, which is the National Crisis Hotline, but 1-888-793-4357 for the
Okay.
mental.
And before I interrupted you, you were saying that some of the things that you've seen and why this is so important.
Sure, we've seen a growth of individuals being willing to reach out for services and for care, especially coming through the pandemic. I think that we are fortunate that having this robust service system has also helped to start to address some of the issues of stigma that we have in the communities regarding accessing behavioral health services. So now there's the opportunity to, when an individual is ready, be able to reach out, hear more about what's available, and really get that support. So also not being so rigid, not so prescriptive that you can only find out between the hours of X and X. Whenever you're ready, the service is there for you. And so that's where the mental health hotline, I think, is one of the more critical resources that the department operates.
And as you said earlier, don't I know you're moving on to the other one too, but I just want to make sure that people understand that not only can, let's say, I as the individual access that hotline if I realize I need personally need help, but what about if there's a loved one or a neighbor, or I mean, how is that line available to them, or is there any other resources? Because we see a lot happening in our communities, and we recognize, as the mayor and others have said, this is not a call for the police. This is call for mental health services. So how is that line available to them as well?
Sure,
Okay.
absolutely. Stakeholders, caregivers, they can absolutely reach out, find out about information and resources that might be available to speak with their loved one, to speak with that neighbor, that friend about. And then, kind of to that point, we also have our community response team, which is the 24/7 direct response arm of the department. So, that is a group of clinicians, peer certified peer specialists, and community behavioral health specialists who operate in that boots on the ground capacity. So they are, when contacted, going out and functioning as civilian mobile responders. They will come and engage the individual who might be experiencing a crisis. But even before we get to the place of a person being in what we consider an acute crisis, they are able to come out, talk about resources, and help shepherd folks through some of the enrollment processes, help provide that warm handoff, that direct touch to individuals who might need that care and assistance to move through the steps of engaging with the larger service system. So they are an invaluable resource here in the district, and we're really proud to have them.
Mental health, has become such a major issue, not only here in Washington, D.C., but all over the country. I mean, we're hearing stories on stories about the mental health crises, as you mentioned, that's happening throughout our communities. And, but, from your observation, that's what I want to know really is what has been your observation. I mean, I know it's some that may be related to drug issues, depression, what have you. I mean, because how do we serve this community better?
I think we I think opportunity exists by virtue of making it known that we do have the resources available. One of the things that we are really fortunate to have is a program like the DBH Learning Institute, where anyone can log in, find out about available classes that might be related to behavioral health, because knowledge truly is power. The term behavioral health gets used often, and it's a massive umbrella that talks about health and wellness. It talks about diagnostic presentations. It talks about a whole human. And so, as a community, what we can do better and where we can really expand that is ensuring that we all know that we have a baseline understanding of what mental health and wellness means, what it means to recognize that you are becoming stressed and might need some additional assistance, and learning that there are resources. Yeah, I know that you heard our director say people are often, if you break a leg, folks are very comfortable going to the doctor, but folks aren't necessarily as familiar with where do I go or what assistance do I seek out when I'm not feeling well. And so being able to help better understand where you can get these services and supports and that they exist. Sometimes the easiest way to mitigate a crisis is to just explain that resources are there whenever you're ready for them. And so that's what's really important for us right now, to expand and ensure that people are aware of.
Are you all equipped with enough staff yourselves and resources to meet the needs of Washingtonians? I know that, everybody's talking about jobs and opportunities, but are you staffed up, or do you have opportunities for folks who might be in the um, in that area, or pursuing that type of a career? Are there opportunities there for folks to come and support what you're doing?
Oh, there are absolutely opportunities for individuals who want to come and provide service. As gets talked about quite often, there's a national workforce shortage in the behavioral health space, and so that's where we are excited to see some of the university partnerships that are coming online. And we always want to see continued growth in the space of having available practitioners and clinicians who want to do the work and be of service.
Wonderful. And I also want to ask about the engagement, because I'm sure you and your team probably go out to community meetings and other places to share more about to do that in public engagement. Talk about that, how folks can get you to come and tell your story.
Sure. So we are happy to come and participate at any sort of event that's available that allows us access to the community. So we will come and participate at tabling events, present at ANC meetings. We do community canvassing. So with a lot of the stakeholders and members of the community will call us out and just tell us a bit about what they are observing, have us walk through communities with them. And so those are all wonderful opportunities. We often also get tagged and asked to come and participate in community education. So talking about things like naloxone and how to get training for the utilization of that life-saving drug, or understanding some of the signs and symptoms of mental illness and who to access. So we are really kind of wide open to what we will come out and participate in, because we view it all as creating opportunity. And we also get to hear from the community about what their observations are and what their experiences have been, so that we can continue to improve upon the way that we provide services in the district.
So I want to go a little deeper on you, Anthony. I mean, tell us your background, and how did you end up in this mental health space?
So, if I am honest about it, I'm the son of a social worker, and my father was with the National Urban League. So this was written in the stars before I ever showed up. I'm from here, and so I have always worked in behavioral health like my entire adult life. So as soon as I graduated from undergrad, I came up here, finished my master's. I began working at one of our core service agencies, so providing direct care to some of the most vulnerable individuals, and kind of just continued along in that space, because I really do view it as an opportunity to provide a voice and provide respectful services to a group that we know historically has been marginalized, and we recognize that we continue to need to improve upon that. And then just to show love to the community that I grew up in, to be a part of the change that we all want to see here.
Wonderful. And I guess in closing, I know, or I'd assume that the agency has a mission, a mission statement or something that you all would love to see happen for DC and its residents, and how that fits even with your own personal mission. But what is it that, as it relates to mental health, we all should be striving for in the District of Columbia?
That's such a big question. I think that what we would want to strive for is education, because the more we understand about ourselves, about our neighbors, about who we are and how we are feeling, the better equipped we are to take steps towards continuing our process of wellness and healing. And that's across the board. Like, we all get better when we all know that we can get better.
Wow, amazing. Anthony Hall, thank you so very much, Public Engagement Director for the DC Department of Behavioral Health. We appreciate your sponsorship of this segment, but we know you're going to be coming back with more information as we go forward. This is much needed information, and we're just happy that you're here. We want to put both of those numbers up one more time, Chevry, and if you could just tell us Again, that's the National Crisis Hotline, and people can call that. Tell us again.
Yep. Or they can call our mental health hotline at
Mm-hmm.
1-888
Okay.
793 4357.
Okay. All right. And that's the number to call either if you need services or if you know someone who you think is in need of services,
That's
correct?
correct. Yep.
All right. Okay. Thank you very much for being with us, and we will see you the next time.
Thank you so much. Take care.
All right. You too. Bye-bye.